Hello, I'm Luke O'Neill and here I am in my lab in the Trinity Biomedical Sciences Institute. So this week on my COVID-19 update, a huge study done in the US, 10 metropolitan areas, all the major cities were looked at, and 98 million people. They were tracked, can you believe it, with their smartphones. And next they looked at the infection in these various places. And guess what? It confirms what we've known all along. Restaurants, bars, gyms, religious places and hotels were all places where super spreading events happen. So it confirms how dangerous these places are. Also interesting was it was the lower socioeconomic groupings who were getting really infected and spreading the virus. The reason is they're trying to gather more in these places. Secondly, they're more mobile, they've got to work more. They can't work at home as much because they're in lower paid jobs. Very important for the US though, because they need to control these places to get this virus under control. And something very, very simple has been proven to work really well for people in hospital. It's called proning. And what it means is turning someone from their back onto their stomach, and this is saving people's lives. There's been a study in China showing a 50% decrease in death rate if you simply put someone onto their stomach. It was first shown in 1976, many, many years ago, for people with respiratory distress. We think what's happening is if you put someone on their stomach, the fluid in their lungs drains away much more easily and they can breathe more readily, more oxygen exchange can happen in their lungs. So no need for fancy drugs, just putting patients on their stomach and saving lives. And big news this week, a second vaccine is showing efficacy. The Moderna vaccine hit 94.5 efficacy. This replicates what Pfizer did. It's the same kind of vaccine. It's an RNA vaccine. So of course this means this is probably going to work as two separate companies found it. We're getting more data from the Moderna vaccine than Pfizer, interestingly. So first of all, it worked in older people, small numbers, but there was a reasonable number of older people protected. Secondly, in ethnic groups who of course are at higher risk. This includes Hispanics and Latinx populations within these numbers. They're showing protection as well with this vaccine. That's very important because those are the groups you want to protect. The other thing of course that people have probably read is, and it's quite a simple one, you can keep this vaccine in the fridge. Now the Pfizer vaccine needs to be kept at -70, ultra cold that's called. But Moderna, it lasts 30 days in your fridge, and of course that's much more feasible I guess to use. Secondly, 6 months in a regular freezer. So who knows, this may be the vaccine that we get there first because it's much easier to deploy. We're waiting for the data of course still, these are press releases, waiting for the data on the patients and also the safety. That will come in the next week or two. Moderna have said they're making 20 million doses as we speak before Christmas, and they will make 500 million doses of their vaccine in the first part of next year. This is what we want, two separate vaccines showing efficacy, so it's great news for the vaccine effort. And you can hear about these stories and more on my weekly COVID-19 update with Pat Kenny on Newstalk.